We are moving to a different area of medicine, veterinary medicine. I think you have not been attending here any other talk about small animals. And I will be talking about cats because I'm a feline medicine specialist. I work in a feline-only practice here in Barcelona. And I just will talk about one disease that is quite prevalent in cats. This is diabetes mellitus. And I will focus on the comparison between human beings and cats, because you will see there are some different aspects that we share.
That's very interesting.
Yeah. Yes. So the aims of the talk will be definition and background of the disease.
You can tell it's a diabetes patient.
Yes, that's right. So the main purpose of this picture is to realize that this cat is not healthy. This cat is an obese cat, and obesity is one of the clues of the disease of diabetes. So we will be then talking about pathogenesis, diagnosis, treatment, and monitoring. So we'll be at the end focus on monitoring. That's the title of the talk. But we have to have an overview of the disease before. So the terminology in feline medicine or in veterinary medicine is not clear. We all talk about the disease very often, but in different parts of the world we use different terms to talk about hyperglycemia, diabetes, remission. Lots of terms are not used the same way. So that's why the European Society of Veterinary Endocrinology took a place in London last year, meeting to make some agreements on terminology. This is not the definition that, as the Alive project, we are working on that. This is not the final definition, but like in human beings, diabetes mellitus could be just a condition characterized by persistent hyperglycemia resulting from the body's inability to use blood glucose for energy. So we are aiming to have more clear definitions used by the whole world, and we started last year in London for the European part. Then it has been during this year in the United States another meeting. So in maybe a couple of years we will have an agreement on endocrinology terminology. So the thing is that we have an increased number of cats as pets in the world, and it's now more popular as a pet in most of the first world countries. So we think that in the maybe following decade, in most of the countries, the cat will be the most suitable pet in every house. And it's been happening in the USA, in the UK, in France, that the cats outnumber dogs as pets. In Spain now, coming from the pet food industry, we know that we have near 3 million cats in houses, not accounting the cats that live outdoor. So only cats that live indoor, that are whose owners are buying pet food from the market. But the main problem with cats as vets is that they don't go to the clinic as often as dogs, because the stress related with the trip, they are not used to go outside the house. They can be aggressive when they have to go to the vet, and sometimes the vet behaves very aggressively with them, because they see the fear in cats and they react with aggression. So that's one of the main conclusions and problems that have been addressed during the last years. This is a study done by Bayer in the United States with lots of cats and dogs, and they realized that the cat was underserved in terms of veterinary visits. And in this study, they conclude that sometimes it was just an event that was very stressful for cats and for the owner themselves. But the diseases are the same, so we have to work with this scenario. The background related to diabetes is that there is a true increase in the hospital prevalence. We don't have data as in human beings you have about the real prevalence in the population. We have data from the veterinary hospitals or clinics that are counted in terms of number of cases every year, and which of these cases are diabetes and which are other diseases. And we know that from the 70s to now, or to the late 90s, it has been increasing, and it's true from the last years as well. And some cats have a higher prevalence and some breeds, and I will show you why. So the incidence has been published recently, and it's more or less this 0.12%. The classification is similar to human beings, and I have this video to show you that sometimes this classification is more or less the same, because we are dealing with the same problem, which is overweight. This woman owns some cats. One of them is this cat. This cat is truly obese. This cat was 17 kilograms weight, has this huge weight, and she had this same problem. So sometimes we do see cats and owners with the same scenario, with the same disease, and this is not obviously the reason why we share the classification, but we are looking for the same background in people and in cats. So in humans, we divide in the last classification into type 1, type 2, and other kinds of diabetes, and in cats we use the same. In human beings, according to the American Diabetes Association, we know that type 1 is less frequent. We know that in human beings there is a genetic and some other factors causing this beta cell destruction. And in type 2, which is the most frequent, this is a problem caused mainly by the hypertrophy of the fat volume in our body. So there are some secretion or increased secretion of some cytokines, IL-6 and TNF-alpha, and these cytokines cause the insulin resistance that at the end will be the cause of this diabetes. These other specific types are a list, so gestational diabetes and other types are in this other type. In cats it's more or less the same. Type 1 is very rare. This is very unpublished condition in cats because there are no anti-insulin antibodies detected in all the patients we have been suspecting this type 1. And in the first communications about clinical cases or case reports about infiltrations in the islets of some cats, we have just identified 2 cases, so it's a very low numbers. That's why in the last years, in 2016, there was a bigger study on endocrine pancreas in cats done from the late 90s to the 2009, taking some tissues, pancreatic tissue from dead cats having diabetes and having other diseases. And they found that there are no differences between the infiltrates in these pancreas, in these specimens, regarding neutrophils and macrophages, but there were some differences in the lymphocytic infiltrates between diabetes mellitus group and controls. So there were some similarities with the type 1 diabetes in humans. These are 2 pictures of immunohistochemistry in 2 cats of the study, showing in the left, in your left side, staining for lymphocyte B, so CD20 positive cells, and this pink color is insulin, so it's within the islet of Langerhans. And in your right side, you see some positive staining for lymphocytes T in another islet of Langerhans. So in those cases, we assume that this infiltration could be showing that type 1 diabetes mellitus could be a true disease in cats as well. But it's still a rare disease. In diabetes mellitus type 2, we have a different scenario, very similar to human beings, where there is an impaired insulin action in liver, muscle, and adipose tissue due to the insulin resistance and the beta cell failure and loss. And it's the same as in people. So there are just some genetic factors. That's why we see that in this breed, Burmese breed, there is a higher prevalence of the disease. We have some same risk factors like obesity. I am not aware that in people there is a gender predisposition, but in cats there is a male predisposition for diabetes. And adipokines, which are very important in the role of causing diabetes, are mainly, as you will see in the following slides, focus on adiponectin lack of production, and some of the same cytokines I told you in people, interleukin 6 and tumor necrosis factor alpha, that are over-secreted in these patients. And on the other side, we have that beta cell failure due to amyloid deposition and beta cell loss due to the glucotoxicity. In people, there is lipotoxicity as well, but in cats, as you will see, only glucotoxicity. Insulin resistance is in cats demonstrated by a 10-fold more TNF-alpha in adipose tissue than in normal cats, 50% less serum adiponectin, and a decreased presence of glucose transporter 4 in fat and skeletal muscles, and by far obesity leads to this insulin resistance and then type 2 diabetes mellitus. Beta cell dysfunction was related in the past to amyloid only, but now it has been described that sometimes it's more important the amylin deposits inside the cell and not only the amyloid deposits outside when they compare amyloid between controls and diabetes mellitus cats. So now they are focusing more on electronic microscopy on these samples to demonstrate this amylin inside causing some interference on the beta cell function. And then there is another interesting paper showing that a cat that has an infusion during some time with saline or glucose fluid, high glucose fluid or high lipid fluid, only has a beta cell loss with the high glucose fluid. So glucotoxicity has been demonstrated experimentally in those cats and has been shown in histopathology that there is an increased loss of beta cells. So, by the other hand, it's good news that it's reversible. So when you decrease these high levels of glucose, you find a compensation and a restoration of normality, but it's been demonstrated in cats as well. So this should be the scenario we find in cats. We know that when a cat is getting fat, is obese, they hypertrophy the fat tissue, the adipose tissue, which interferes the secretion of adiponectin and glucose transporter 4, but stimulates the secretion of TNF-alpha and IL-6. This, at the end, causes the same scenario in skeletal muscle, liver. At the beginning, the pancreas is compensating this issue with high levels of insulin, but at the end, this pancreas is exhausted, and finally we have diabetes. So, when we know that cats are so important in our houses, that diabetes is important in those cats, now we have to transmit you how to do the diagnosis. And we don't do it just by the demonstration of hyperglycemia, because cats have stress hyperglycemia. So I am very used to see cats in the practice with glucose of more than 200 milligrams per deciliter, which are not diabetic, just showing stress. So they are in this side of the chart, and that's why it's so crucial to understand the disease not only as a number. We have to demonstrate polyuria, polydipsia, polyphagia, weight loss, and then, obviously, the persistent hyperglycemia, glycosuria, and one thing it's similar to glycosylated hemoglobin in people. We use more fructosamine because it's more validated as a tool for long-term glucose persistence or elevation in cats, and in experimental settings we use the same test, that is the glucose tolerance test. There is some interest now for deciding which are the cut points for normal cats, because we have this problem of stress hyperglycemia. So that's why we are not happy just saying a cat has high glucose levels because of stress. We're trying to say that cats with screening blood glucose for above 189 should be retested, and if the second screening blood glucose is over 116 after several hours, and it's not exclusive for glucose, we have the same problem with blood pressure in cats. I have seen cats with more than 250 millimeters of the systolic blood pressure just for stress. So we have to reassure that these cats are not diabetic in the first stages of the disease. So that's why there have been some papers on these issues as well. There are some problems associated with fructosamine, which is the similar molecule that we use for confirming the disease, and not also because they can increase very, very quickly, but also because some other diseases can decrease the levels of fructosamine. We treat them with insulin, so although they are in the type 2, and type 2 in human beings are mostly treated by oral hypoglycemic drugs, in cats there is no reason to do that, because the pancreas is exhausted in most of the times, and at the end of the disease we have seen that some of the drugs that we can use orally terminate with more exhaustion of the pancreas, although 30% of those cats will respond to the disease, to the treatment initially. But we mainly use insulin, and we use human products like Lantus, Levermir, but we have our own products that are similar, and this is the one we use for ketoacidosis, or initial management of acute decompensation. We all know, the same as in people, that Glargine and Detemir are longer-acting insulins, but we don't use another insulin when they eat, because cats can eat 20 times a day. So some breeds 60 times a day. So it's not normal to use small injections of short-acting insulin at the same time as longer-acting duration insulin. And our main problem is that insulins in cats long very short time. So that's why we tend to use these ones. This middle one, Prozinc, is one of the newest in the veterinary market, but it's similar in action and duration than Glargine and Detemir. And caninsulin is the older one, which in some countries that they don't have Prozinc, they are obliged to use it because of legal issues. The initial dose is so tiny that you, as human doctors, maybe will love, because it's 0.5 units per cat, 1 unit per cat. So some devices that are automatic fail because 1 unit is so tiny that it's not easy to dose properly. It's crucial to use tiny pediatric syringes that allow the owner to see clearly that they are giving the exact dose. And some of the vet products come with dedicated syringes, and there is just a sample of what we have to talk about diet in diabetics, because there is no time to do that, but diet is very, very important. So we use high protein, low carbohydrate diets, which allow the better glucose management for the cat and weight reduction. So for monitoring, we have some options. The oldest one is to do spot or just blood sampling in the best friendly way, just to determine the blood glucose at that moment. So this is something that is very difficult to then know how is in the real scenario at home, because they have been traveling by car with some stress. So again, stress hyperglycemia is a problem, and if we rely on these results this day, maybe we are failing. And that's why the old way to deal with diabetes in cats, that should be maybe once a month to do this, has changed to the home monitoring in the pinna, or maybe in the paws, and we got some samples that could be analyzed with or a glucometer dedicated for pets, or a human medicine glucometer that could be maybe a little bit less because of the size of the red blood cells, but it's okay to have trends. And another way to just control for hypoglycemia is to control urine glucose, because cats have a higher renal threshold for glucose, so unless they have less than 270 milligrams per deciliter of glucose in blood, they pass glucose all the time. So it's much more difficult to assess glucose hypoglycemia with this way. So our goal will be to have glucose between 80 and 252. So it's a very high or wide range to assess. Mostly, if you think about human beings with diabetes, that could be mostly around 100. We use fructosamine, and we wish that this fructosamine goes into the upper range. We want to avoid hypoglycemia, ketoacidosis, and in cats achieve remission, because remission is through a scenario in these cats. If you do right in 3-4 weeks, they are normoglycemic again. And at the end, the quality of life. And quality of life has been examined in lots of diseases in cat medicine, in feline medicine, but in diabetic cats, it's a very tough scenario, because they find that some people, when they deal with cats with diabetes, they tend to put to sleep the cat because of the difficulties they find. So our quality of life issues is that people will find in their lifestyle problems when they leave the cat with their families or friends, when they have to be traveling with them. The social life could be altered because they have to inject twice a day insulin to their pet. The work life as well, they want to control very well. Some physicians that they have as owners want to have so tightly control the cat that they extrapolate what they know about human beings, and they want the cat to be at 100, and it's a problem because cats are not so easy to control. And the costs, because maybe not in Spain, but when I have been in the United States, the cost of veterinary medicine is so high that some people are not going to just pay for it for life. And for the pet, they worry about the general health, obviously, and some people, most of them, are afraid about hypoglycemia because they think that when they are sleeping, maybe the cat will be scissoring or something like that. So we will be managing both pet owner bone and diabetes, because if we fail, we find that some people will ask you to do, or ask me to do euthanasia. We tailor the management to each individual situation, so we have to adapt. And the relationship between the pet and the owner will be stronger, and some of these people, they do very nice job. So this comes with with audio, sorry. And I will try.
Diabetic cats require regular blood glucose monitoring that can be performed
This is the
by
way
the owner
we
at
do.
home. The small vein near the lateral edge of the pinna can be used to collect a drop of blood. The vein may be visualized using transluminescence, or it's possible to simply employ a blind puncture technique. Here we are using a human glucometer, although veterinary devices are also available. Note how the test strip is placed in the glucometer without touching the end of the strip. A fine needle is used to puncture the vein. Fingertip pressure produces a small drop of blood, which is then taken up by capillary action onto the test strip. As you can see, the procedure is not painful for the cat. Sometimes it's necessary to warm the ear before the procedure. Following the blood sample, the ear is disinfected and you simply wait for the result. This method of sampling generally underestimates blood glucose levels, but you can teach the owner to perform the technique at home and you will get more reliable results because the cat is not stressed by the trip to the surgery. You can ask the owner to record the blood glucose every 2 hours at the start of the treatment, or every 2 or 3 days once the cat is stabilized. You can provide the owner with a simple spreadsheet-type file where the data can be entered. This allows easy follow-up of the cat's response to treatment.
So this is the way we deal with this control at home, with the home monitoring. And at the moment, this is an old video we recorded at the practice, we use spreadsheets on the cloud. So we access whenever we want to the results of each patient, and they can just send an email with the doubts they have under control. But we are not telling them to change the dose or change anything until we tell them. So they just they put the numbers on the cloud. This is an example, or there are 3 examples of how we manage the home monitoring. This is a 14 years old female spayed European cat with some evolution of the management and the impact on polyneuropathy. But like in people, diabetic cats have polyneuropathy mainly in the hind limbs, so maybe in the lower limbs in human medicine. And this is the data in May. So you see high numbers here, and May of 2017, January 2018, nice numbers. This cat is well controlled. So this is the same cat with 2 videos of how the hyperglycemia affect to the peripheral nerves in May of 2017. You see that there is an abnormal gait, and the same cat here, Peda, in February of this year with a resolution of these neurological problems. So this is one of the good things about home monitoring. We can closely control cats that have neurological consequences. This is another case of a cat that is highly bound to the owners. So they are very proud when they bring you without the cage, so they swing just with the arms, and they present it just for dysuria, a problem related with the urinary tract. It was diagnosed 6 years before of diabetes mellitus and has had 2 episodes of hypoglycemia. And home monitoring is a good way to detect hypoglycemia because he was on 3 units of Lantus every 12 hours, and the referring vet was asking me to do the same that he did, that was glucose curves. And glucose curves in this cat were not okay. So in the clinic, it was a good glucose curve. So we tend to, we wish that the numbers were close to 300 and above 80, so it's okay. But the same cat some days after at home has these numbers. So we need to have more in-depth home monitoring. So that's why we use it since August 2017, and this cat has been using an application from the Royal Veterinary College in London that sends me the data about the control, and this cat is controlled since then. And another scenario will be cats with very high demanding doses of insulin, like Leah. Leah is a 13 years old female spayed domestic short-haired cat with 11 units of Lantus twice a day. So this cat needs glucose curves every day because she has a tumor in the hypophysis. She has high acromegaly, and the disease needs higher doses of insulin, and that's why we need to avoid hypoglycemia in case the cat is not eating, and monitor treatment that at the moment is coverable. And the last thing I want to introduce you is the continuous glucose monitoring that we are using at the moment. There are some devices that we can apply with the diabetes in cats, the Freestyle Libre from Abbott, Guardian Real Time, and Dexcom G5. And we are using the Freestyle Libre. There are some papers showing very promising data about the well-controlled, which in people is used in the arm. It's a device that records the glucose in the interstitial fluid. So there is a delay between the glucose in blood to the interstitial fluid of 11 minutes, more or less, in cats. And these are the data we obtained the same day of the implantation, that this implant is going to last for 15 days. So the data showed a very good correlation between the glucose obtained by the glucometer, the glucose of the freestyle, and the glucose of the freestyle 11 minutes after. And we use just to hold the head for some seconds to properly stitch of the sensor, but that's all. The cat just is happy with the implant. It's not going to hurt, and as you will see, we just cover the implant because it's costly to be lost. So it's nearly 100 euros, but it's going to replace glucose curves for some days. So it will be worthy to use it in cats that are not living with owners that are able to determine these levels of glucose daily. Just we cover with a couple of dressings, and that's all. And the cat used to rubs and walk without any problem because it's not going to compress the neck in any moment. So when we do that, we allow them for just 1 minute to initialize the device. So the device needs a calibration of more or less 1 hour, but this device is not going to be touching the cat, so it's like a scanner, and it's going to work in 60 minutes, and it's recording more than, it's a glucose every minute. So the scanner will, the glucometer will record lots of numbers. We will have a graph like this. This is not from Susie that you saw in the video, but you will see when there is risk of hypoglycemia and maybe should be just unseen by the owner. So you will be adjusting the dose properly because of this data. So in summary, we have the diabetes mellitus in cats is mainly type 2 like in humans, that the obesity plays a crucial role in the pathogenesis, that the treatment goals are avoiding the hypoglycemia, the ketoacidosis, achieve diabetic remission, and improve the quality of life, but both the owner and the pet. And home monitoring is superior, achieving a good control of the disease, and that the continuous glucose monitoring is the future in cats. So thank you very much.
Is there any question before we? Any questions? You have a question?
Thank you for your excellent presentation. Do you have insulin for cats or you just human?
We have two different types of insulin for cats that are registered for use in cats. One of them is for dogs and cats, and the last one, Prozing, is only for cats. So we legally we have to use first this kind of insulin, and if it fails to control the disease, we can switch to a human being insulin.
A human being?
Yes, because there is just four differences, 4 sites of difference between the insulin structure between human beings and cats, and the more close to the cat insulin is the cattle insulin, bovine insulin, and but we can use recombinant human being insulin, and I have been using it for 10 years or more.
They're very similar, or
yes.
even maybe identical almost.
Yes. 4 sites difference, and it's very different.
Yeah.
It's similar. Yeah.
The reverse can be used? We can use this insulin for cat for human?
I don't know.
It hasn't been tried, huh? Yeah, okay. Any other
questions?
I have one question. Now, this has been a very comprehensive, nice presentation. Thank you. Just one question. I noticed one thing. You've done everything possible on every front into, this type of study and research. That's very good. But in regard to risk factors, which I've noticed, you haven't done anything towards cat food, packed cat food?
Yeah, we did just a slide. Yes, we have used for years diets exclusively designed for diabetes that are not the same type of diet that the ones we use for weight management. But obesity, it's crucial to deal with when we have those patients. And other strategies we have been using is to avoid breeding with some families of Burmese cats that are predisposed to diabetes. But as obesity is the main risk factor, and there are also other risk factors like some drugs we use for instance, steroids are diabetogenic, and we tend not to use long-lasting steroids on cats that are overweight and male. So, and the other strategy is to detect pre-diabetic cats very soon. But dietary management is the most common way to address with risk factors.
Right. But also at the same time, I meant the dog food as a risk factor. I mean, artificial materials in the dog food,
No. They have, as in hyperthyroidism.
Any triggering factors or chemicals in dog foods in general?
I'm not aware of any research that has been showing these issues. There is not the same in hyperthyroidism. Hyperthyroidism is another endocrine disease most common than diabetes. And in hyperthyroidism, we know that flame retardants, and we know that some the cans, the tin of the wet food is related with the appearance of hyperthyroidism. The same with some pest control products. The same with some radiation. But in diabetes, unless maybe I'm not aware, but unless for what it's published, there is no relationship with diet. But diet is the way to deal with obesity and to deal with better glucose control during the
Right. Yeah, maybe for the future it could be a good idea to do some kind of...
Yeah, because some obese patients are not diabetic. So in some point there is a wrong pathway that could be explained by genetic alterations that are not inherited. So acquired genetic problems that are related with some environmental factors. But I'm not aware of any research at the moment.
Yeah, maybe in the future.
Yes, and we are a step back from you. So in veterinary medicine, I was discussing that we have no enough research at the moment. So maybe we are just one step back.
Yeah, sure, but that could be a very significant step, for the future. Because now, in some households, families don't prefer packed food, ready food, artificial food.
Yeah, that's right.
So they feed their cats with natural food like normal meat. The meat we eat.
Raw meat.
And meat and some similar things, and natural sorts of food. But most families go and buy packed, food with artificial materials. It could be a good idea to conduct a research, comparative research between the ones, with natural fat, with natural food, and the ones with the packed artificial food. That could be interesting to research into.
Yeah, that's right.
Yeah.
I agree.
Yeah.
Thank you very much.
Okay. Thank you.
Thank you.
Any more questions? I have one question, Doctor.
Yeah.
Would you care to recommend something for cat owners here in the audience, so that not only for their pets, but for their own diet?
I used to, but no.
Perhaps there's, as
I think
Dr.
you
Brindes was
want a
mentioning,
cat,
there's a
right?
correlation there with the
Clara, you want a cat, right?
I have one.
Yeah, so there are two types of correlation between the diet and the ownership of a cat. So the first one is that any cat that goes outdoor and is able to hunt could be bringing house toxoplasmosis, which is a parasite that is, the cat is the reservoir of the disease, and is the only animal that is able to not only be infected but pass the cysts by the fecal material.
Sure.
And so it's quite important in human, in owners that are allowing the cat to go outdoors, to be aware that the disease could be happening at house. But there is no, so this is not the only thing. So the way that he proposed to feed cats with non-commercial food, at least in the more warm countries, has brings some other health issues in people, because cats that are eating raw meat, especially chicken, raw bones, could be suffering salmonellosis, and salmonellosis or campylobacteriosis are diseases that could be transmitted into human beings when the cat is sick, and some cats will be getting antibiotics because of these diseases, that if the treatment is not prescribed by a veterinarian and is not done with antibiogram, could be leading to some bacterial resistance. Now we have to be very strict prescribing antibiotics, not only in the human world but also in the vet world, because antibiotics won't last forever. And we are, two of the videos of the human health or human hygiene are very important when we deal with antibiotic resistance, because before doing antibiotic treatment in cats, in dogs, in people, it's more important to clean, to disinfect, than to, this is the way to prevent those diseases. So giving rest of food to cats could be a health issue. And in pregnant women that are the more vulnerable to toxoplasmosis, having a cat as a pet is not a risk factor. It's done research on that. It's having a pet that goes outdoor and maybe get the disease, or having or eating food that has been contaminated by outdoor cats. But a cat is not a risk factor, at least by the research done at the moment. A cat living at house, and sometimes, and I remember my first bite at the practice. My wife is a human doctor, and I remember I told her, okay, I got a bite, it's okay, it's not painful, and she told me an antibiotic.
Right.
So I told her, no, it's not a problem. Cats are not so dangerous. And she brought me a book about antibiotic prescription, and dog bites get infected 50% of the times, cat bites 80% of the times, human bites 100% of the times.
Oh my.
So that's the main issue. Sometimes cats are,
That's interesting. Yeah.
but we share some problems, and it's a good point into account.
no biting.
Yeah.
No biting human.
No.
That's very interesting.
Please.
Thank you.
Would you like to share anything else?
No, it's okay.
Okay.
Any questions?
One question.
Sure.
Do you use HbA1c to control estimate glucose control in cats, as in human HbA1c?
No,
No?
No, we don't use it. We just use for the monitoring. We use the glucose levels from maybe spot checking or continuous glucose monitors, and we use the fructosamine, but we don't use the hemoglobin. And I don't remember if the problem was the type of hemoglobin, which is different with the cat hemoglobin, and it's not easy to validate in most of the labs. But we only use fructosamine, which is more or less the same. Fructosamine is the level of albumin that is attached with glucose in the serum, so it's affected by mainly the same things. And we have an average of 15 days of glucose levels with these values. But there is no hemoglobin, glucose-related hemoglobin studies in dogs or cats unless 30 years to now. So it's been just in the past. It's done in the beginnings of the diabetes control in dogs, but now there is nobody using it.
For how long this device you use for continuous?
Yes.
For how long does it stay in the
15 days.
15?
Yes. After 15 days, the device stops recording because the device is for human beings and has an internal memory that records every 8 hours everything. You pass the glucometer, you have all the values there, and start again. So at 15 days, the battery runs out.
What's the cost? What's the price of this?
More or less 100 euros. 100 euros.
It's used for human.
It is from human beings, yes.
So it was very interesting presentation. You talked about the cats and their diseases, but can you tell us anything about how much we are at threat when we have cats in the house? I mean, human health, the threats to human health if there are cats in the house.
I think there are more studies on the benefits.
On the benefits.
Yes, decrease the blood pressure, release the anxiety, and the threats of having a cat house without being a predator. So cats that are only indoor, which are the majority of cats, live only in the house. So they are not getting diseases from outside, and
but
it's great. It's quite difficult when they are socialized to bite people.
Yeah, toxoplasma. Yeah.
Toxoplasma is only affecting a cat that hunts, so the cat's outdoor. So inside the house, there is no way to get this disease. And most of the cases that I have been asked about toxoplasma in pregnant women, we have demonstrated the cat has no antibodies. So some of the cats that have antibodies to toxoplasma have IgG, so all antibodies, and we tell the owner, okay, we don't know when, but the cat had toxoplasma in the past. It's not going to be passing the parasite through the fecal content anymore. So there is no risk. Even it's better to have IgG in a cat living with a woman. But in these cases, yes, there is a concern about having a cat. And I have 3 kids, and I remember when we were waiting for the first one, my grandma told me, get rid of the cats. So it's a common issue. But besides the toxoplasma, maybe there are no much more concerns about having a cat.
About it sheds its hair.
Yes, but hair. So another benefit that I have not mentioned is that it's not the hair; it's a protein of the saliva that is very antigenic. So the immune system is very reactive to this antigen. So that's why so many people are allergic to cats. But when you compare kids that have been living through the first year of life with 0 cats, 1 cat, or 2 cats, and you compare those groups of kids when they are 8 years old, they have demonstrated that kids that have been with no cats or 1 cat are more or less the same allergic, atopy, asthma, so on. But kids with 2 cats during the first year of life are just the middle, so are less allergic, because the immune system has to build during the first years of life. So having something that is very antigenic at home is beneficial for the immune system.
For resilience.
Interesting.
So it's been demonstrated in the past.
Very interesting.
Very interesting, yeah, very interesting. Very nice points we learned today.
We know in human being doctors that vitamin D deficiency contributes to insulin resistance. Is the same condition is happening in cats?
Which condition? Sorry.
Vitamin D deficiency.
Vitamin D
In human
deficiency.
being contributes to insulin resistance.
No,
and predisposed to diabetes mellitus
Okay.
type 2.
The last research done on vitamin D deficiency in cats showed that there is a pro-inflammatory condition related to this, but as they don't depend on the sun, it's only a matter regarding to the food, and the food is quite well controlled because we use commercial food. There is not a relationship at the moment with diabetes, but there is a huge
There's many researches in
Yes,
human
yes.
being about the relationship between vitamin
and
D
we
deficiency
have
and insulin
vitamin
resistance.
deficiency
Yes.
in very warm countries like Spain. So it's a problem here
Yeah,
with
within
human
doors,
beings.
yeah.
But in dogs and cats, we have more problems with hypervitaminosis D because of some problems in the teeth, some problems in the kidneys are related with vitamin D toxicosis because manufacturers tend to use higher percentage of vitamin D in the food just to ensure that by the expiry date the vitamin D that they tell in the label is okay. So we have more problems with hypervitamin D than with low vitamin D in the diet.
Thank you.
You're welcome.
Any
Are there any more questions? No? Well, thank you very much, Doctor.
Thank you very much.
And a great